Sciatica therapy. Let's talk about what is done in a typical session for sciatica here at the clinic. So just to recap, this here would be a model of the bones of the lower back. So you see here the bones, and that's the discs. So the discs themselves are you may have two main parts. You got the tough ring on the outside and the jelly in the center. And this here will be the spinal canal, this hole right here, and then the spinal cord is going to pass right through here. And then coming out to the side will be the nerves that exit the spinal canal that will then supply the legs as they move downward. Now, let's say you have an issue with the disc where it is bulging. So in these two models here, we have some issues with the disc. Of course, this one here, it's more severe, where the jelly-like center, pushes out and it begins to go into the spinal canal. This one here is not as bad. There is some of this bulging, but it doesn't actually go into the spinal canal. Now, look at this disc over here. This here has bulge, and now it is pinching all the nerve. So this is one of the nerves that flows downward and will supply the legs. So if this nerve is impinged on or pinched, the leg is going to get symptoms, pain, tingling, numbness, and when it's really bad, then you get weakness in the leg. So this here would be the picture of sciatica. Sciatica would be a pinched nerve of the lower back. So in the treatment of sciatica, one of the methods or techniques that is employed would be massage therapy. Now, why massage therapy? Now, the back itself obviously is made of bones. I mean, you have the disc, but you also have ligaments and you have muscles that are obviously not seen on this model here. Now, if you have a disc that is bulging and pinching on a nerve, like this one here, if you have the muscles on the side here that are tight, and in the picture of sciatica, a lot of the time there will also be associated tight back muscles. So when the muscles are tight, applying this downward force here, it makes the pinching a lot worse. Now, if you employ massage therapy and you loosen the muscles, as you can imagine, when the muscles begin to lose some tension and they relax, pressure on this nerve here due to this bulging just would be less, and then you will have less symptoms. It obviously is not going to go away in one session, but then that will lead to a reduction in pain in a lot of the cases. Another part of the therapy would be exercise and stretching. So massage therapy would help you release the tension in the muscles. And now exercise and stretches, that also goes further in helping to decrease the pressure on the nerve due to the disc. So when you do exercise, that causes the spine to flex and then to flex and to extend, it helps to give back mobility to the spine. And what that can in turn do, in a lot of cases, it can reduce the pressure the nerve is experiencing due to the bulging disc. Same thing with stretches. So massage, exercises, and stretches will lead to a reduction in the muscular tension on the spinal column, and that will in turn lead to some reduction of pressure on this nerve here. Now, with sciatica, that is a pinched nerve of the lower back. Now remember, the entire body is connected. If you're having sciatica, we also have to look at the neck and the upper back, because as you can imagine, if you have tight neck muscles or tight muscles in the middle back, it can in turn lead to increased pressure here or muscular tension in the lower back. When doing massage therapy for sciatica, it's not just going to be about the lower back, but also work needs to be done on the middle or the upper back, as well as trapezius, as well as the neck muscles. And in that way, it will help to release as much tension along the spinal canal, leading to the most relief possible when it comes to massages, exercises, and stretches. Another method that can be employed in dealing with sciatica would be forms of electrical therapy like the TENS or the EMS. Now, with the TENS electrical therapy, the theory upon which that works is in the manner in which you apply the electrical current, it helps to modify the pain signals, leaving the affected area that reach the brain. So it sort of modifies the signal that the nerve is giving off and that the brain has to interpret. And when you modify that signal, the person can sense less pain. With the EMS and TENS, there's a bit of a crossover. If you put TENS on a very high voltage, leading to a lot of hospital contraction, that more or less would be also EMS. But EMS would be electrical muscular stimulation. When you have a muscle that is tight and then you begin to contract and relax that muscle for a while, what happens is that the muscle tends to lose muscular tension. It relaxes. So electrical therapy that helps to contract and relax the muscle multiple times can lead to a reduction in the muscular tension. Again, to massage is one way in which to release muscular tension. EMS can also be used to reduce muscular tension, but of course using an electrical current. So the question is electrical therapy painful? It can be uncomfortable, but sometimes a certain degree of electrical current needs to be passed through the muscle for it to be effective. If it is too light, or the voltage is too low, or the current passing through the muscle is too low, you may not really get the relief that you're looking for. But of course, there's a difference between between something being uncomfortable and something being excruciatingly painful. Obviously, we don't want to express a lot of pain, but in this session, there may be some level of discomfort. And you'll have to bear with the therapist as she tries to relax the muscle by applying the appropriate amount of current. If that current is too low, you may not actually get the results you're looking for. Again, so electrical therapy can be uncomfortable, but we don't want it to be excruciatingly painful where it is unbearable. Red light therapy. Now, red light therapy, as well as near-infrared light therapy, can be used to help to loosen the muscles. In the same way which you're using massage therapy, electrical therapy, to help to loosen these tight muscles to help to relieve the pain, red light therapy can also be used. So when a person comes in, the red light therapy would be applied across the back like this. I can help to loosen the muscles of the back, the glutes, the hamstrings. And again, too, this will be an adjunct to the massage therapy as well as the electrical therapy. Typically not really used as a standalone therapeutic modality, but rather used in conjunction with the other modalities. Now, let's say in a case where a person comes in and very severe sciatica, you can't even touch the person. And what can be done? The person can do a red light therapy, maybe 20 minutes of red light therapy, help to loosen the muscles, relax the muscle, and then you can attempt to do massage and see if the person can tolerate the therapy. So that's another way which red light therapy can be used. And with this particular mat, we can actually we can adjust the intensity. Right now it's on the lowest intensity. A bit medium, and that's the highest intensity. Dry needling. So dry needling, what this technique is all about, I'm going to show you this here. This is one of the needles, one of the types of needles that will be used. That could be used to treat sciatica. Needle is put into the muscle that is tight, and that also helps to relax the muscle. So let's go to open this one to show you. That's the and you see the needle inside of the tube. I'm going to remove it, and I'm going to show you what the needle is about. So this is one of the needles that can be put into the muscle. It's very thin, and you really don't feel it when the needle pierces the skin. You may get a sting or a burn or uncomfortable feeling as the needle enters the tight region of the muscle. Okay, so this is one of the needles that could potentially be used to relax the muscle when we are treating sciatica. Now, additionally, an electrical current can be applied through the needle to stimulate the muscle, and this is what will be termed the electroacupuncture. So there are two methods which can be used. Once again, we can just put in the needle as is or apply an electrical current to stimulate deep within the muscle belly. Cupping can be used as another way in which to relax tight muscles. This here will be an example of a cup that will be used in the cupping therapy. So let's say you have a tight muscle. Of course, many of you would be familiar. You put the cup over the tight region of the muscle. In case of the back, you put it on the back here, and then you have a special vacuum gun that is going to suck air out of the cup, and that is going to cause the muscle to be, and the skin to be drawn into the cup. When you create a vacuum around the area, what's going to happen is it's going to draw more blood to that area. The capillaries are going to dilate, and then you're going to flood that tight region of the muscle with a lot more blood, and this can potentially lead to the muscle relaxing. Now, one of the side effects of the cupping would be a red spot on the area where you apply the cup. This is harmless. This is really maybe some of the capillaries broke and you got some superficial bleeding under the skin. This goes away in about 2 weeks, depending on how what level of suction was used in the cupping therapy. Okay, so this is again another way in which to help to relax the muscles. Inversion therapy. So this is where a person goes around inversion table and the person is turned upside down, but in a lot of the cases the person will not be turned all the way upside down. We will use a shallow angle initially, put the person on maybe for 5 minutes just to see how they respond. And this uses gravity to help to stretch the spinal column, the muscles as well as the ligaments, helps to take some pressure off the nerve that is being pinched. So once again, where you can visualize, so coming back to our model again, here's the nerve being pinched, and imagine we put the person on an inversion table, not necessarily all the way upside down, but let's say at a shallow angle, let's say a 5 to 10 degree angle, and our gravity is pulling this way. As you can see how that stretching the spinal column, some of the pressure can be taken off the pinched nerve. Where inversion therapy is concerned, typically that would not be the first thing we do when you come in. We would rather warm up the muscle, stretch the muscle a little bit, and then put the person on the inversion table. Now, if a person has uncontrolled high blood pressure, vertigo, any of these issues, we may not put the person on the table. Okay, so the table does have limits. We don't want to lower a person who suffered from vertigo to have an episode while doing inversion therapy. If you have acid reflux too as well, that is something that we may not want to do with you. If your pressure is uncontrolled, another reason we may not want to do the inversion therapy, as well as people who have what is called spondylolisthesis. That is where the bone slips forward. And in a case like that, that is something where we would not want to really use inversion therapy, as inversion therapy can make that situation worse and worsen the pinching of the nerve. So inversion therapy is there for everybody, but a lot of people can benefit from inversion therapy. Medication. Now, in terms of medication, the three main classes of medication that can be used to help to manage sciatica be anti-inflammatory, such as diclofenac, muscle relaxer like acrofen, as well as another anti-inflammatory, steroid anti-inflammatory such as dexamethasone may be used. Opioids like tramadol typically is mixed with gravel when it is given orally or as an injection. The reason you're mixing tramadol with the gravel is that one of the side effects of tramadol is to make you feel nauseous. So the gravel is used to offset that side effect. In terms of the anti-inflammatory such as diclofenac, if a person has uncontrolled high blood pressure, you will not want to give the diclofenac injection or oral diclofenac. If a person has acid reflux, we will not want to give the oral diclofenac, as that can worsen the acid reflux. Uncontrolled diabetes, uncontrolled high blood pressure, and dexamethasone, which is a steroid, generally will not be given if your sugar is very uncontrolled or your sugar is or your blood pressure is not well controlled, as a steroid can cause a temporary surge in sugar and in pressure. So again, the three main classes would be your anti-inflammatories, the muscle relaxant, as well as an opioid. And examples would be the diclofenac, dexamethasone, and tramadol mixed with gravel. So that's how medication factors into the treatment of sciatica. Now, these anti-inflammatories, while they do, yes, some people may say, okay, well, that's just masking the symptom. They want a treatment. Now, while I agree that in a way, yes, the medication are quote-unquote masking the symptoms, they also do help with the treatment of sciatica. So again, I want you to visualize the nerve being pinched by the disc here. This nerve is being irritated and it's inflamed. Now that chronic inflammation is going to cause nerve injury. If I give you an anti-inflammatory, it's going to calm down that area and it's going to protect the nerve from further damage. So don't just think about the medication as simply masking the symptom. Medications themselves can help to protect the nerve. And also as well, a lot of people cannot sleep because of the pain. Now your body's not going to heal if you're not sleeping well. So if I give you medication that makes you more comfortable and helps you to sleep, that helps with the treatment of sciatica. I don't want people to be so adverse towards medication unless you have an allergy towards a particular medication. Well, that's different. But if you don't have any allergies and the medications are not contraindicated, then I really encourage you to take the medication as it would, again, protect the nerve, as well as it can make you more comfortable and help with the sleep. And of course, proper sleep goes a long way in treating any medical condition. Supplements. Okay, so vitamin B supplements are helpful in the treatment of sciatica. So high amounts of the vitamin B1 and the B6 can help to protect the nerve, also help the nerve to heal. So I encourage people again to also take the vitamin D supplement while they are treating sciatica. Okay, so I hope you enjoyed that talk on the treatment of sciatica. If you have any questions or you want to book an appointment, you can call or WhatsApp 747-5297 or 308-3370. We are located at number 4 Chincuna Gardens, Chinchin Road in Cunupia.
You can tap the description below for all of our contact information.